Hi, I'm Dr.Gradishar, Professor of Medicine and Chief of Hematology Oncology at Northwestern University and the Robert H. Lurie Comprehensive Cancer Center in Chicago. There are a number of different anti-hormonal agents that can be utilized, and really what dictates when you have to go on to chemotherapy is largely based on two things. Number one is you evaluate whether the patient continues to be endocrine or hormonally sensitive. It's often a misnomer, number one, when we say hormonal therapy. Actually, what we're giving women are treatments that we view as the opposite of a hormone. They're anti-hormonal. But first, we want to determine whether the response or duration of benefit from the last anti-hormone therapy was actually pretty long. So if it's measured in months, many months or years, that would be supportive of the idea that perhaps another anti-hormonal therapy could be used. Whereas if you had another patient where she went through a series of anti-hormonal therapies, and with each different anti-hormonal therapy, the duration of benefit declined. So you were now seeing women who had just a few months of benefit before the disease progressed. That would be a situation where we would think chemotherapy may be more beneficial. In other words, the tumor is becoming hormonally insensitive. And as a result, chemotherapy may be an option. The other caveat that we have to think about as well, as patients go through a series of treatments, sometimes we have to reconfirm that the tumor remains hormone sensitive, or that other markers that may suggest hormonal resistance have not developed. And that can be assessed either with a repeat biopsy or considering even more recent things like looking at circulating tumor DNA. So again, we always want to use to its optimum anti-hormonal therapy for as long as we can before going on to chemotherapy.